The new GOP Megabill and its impact on Texas, a shift in healthcare, taxes, and beyond. Stay informed. Subscribe to The Brief, the Texas Tribune's daily newsletter that keeps you updated on the most crucial happenings across Texas. After weeks of heated debates, intense negotiations, and various amendments, the Republican-led sweeping tax and spending bill is now on its way to President Donald Trump's desk for final approval. This extensive legislation embodies a significant portion of Trump's domestic agenda for his second term, promising transformative shifts in healthcare, taxes, and immigration policies that are bound to influence nearly every American's life. Let's dive into how this megabill reshapes key areas in Texas. Healthcare, Medicaid, and ACA changes. Imagine a situation where over 300,000 Texans could see their health insurance vanish by 2027 due to overhaul changes in Medicaid. Medicaid, the essential federal state health insurance program for low-income and disabled individuals, serves over 4 million Texans. The federal government shoulders nearly two-thirds of the program's hefty $57 billion annual cost in Texas. However, estimates from the nonpartisan Congressional Budget Office suggest Texas might lose about 10% of its federal Medicaid funding, translating to a $39 billion reduction over the next 10 years. These cuts could have severe implications in places like the Rio Grande Valley and rural areas, where healthcare facilities depend on Medicaid payments and have a higher number of recipients. Texas already has the highest rate of people without health insurance in the country. But here's where it gets controversial. The bill also complicates the process of obtaining coverage through the Affordable Care Act marketplaces, and it allows the Biden administration's enhanced premium tax credits to expire. Considering that Texas has not expanded Medicaid under the ACA, many Texans depend on these marketplace coverages and the tax credits to manage healthcare costs. Combining these modifications, around 1.7 million Texans might lose their health coverage, adding to nearly 5 million people under 65 who are already without insurance in the state. A historic shift. For the first time, the bill mandates work requirements for Medicaid recipients across the nation. Those aged 19 to 64, except for individuals with disabilities or those caring for a child under 14, must show they are working or studying for at least 80 hours a month. This has sparked debate. In states that previously adopted work requirements during Trump's first term, enrollments fell sharply, even among those employed or eligible for exceptions, but struggling to provide proof. And this is the part most people miss. Texas Health and Human Services must now implement and enforce these work requirements according to the federal laws. Senator John Cornyn, representing Texas, assured that these measures would solidify Medicaid for its primary recipients, children, the disabled, and pregnant women. However, critics argue that these policies may cause more harm than benefits, particularly in densely populated areas and rural regions, where healthcare infrastructure is vulnerable. Food assistance. Impacts on the SNAP program. The bill also introduces significant changes to the Supplemental Nutrition Assistance Program, SNAV, formerly known as food stamps. For Texas, the extent of the SNAP cuts hinges on how frequently the state miscalculates benefit payments. If the error rate is below 6%, Texas doesn't have to share costs, but if it exceeds that, the state must cover a portion of the costs based on its error rate. Texas reported a rate of 8.3% in the previous fiscal year, meaning it would need to manage 10%, $716 million annually, of SNAP costs. The program's funding requires the state to shoulder 75% of administrative costs, an increase from the current 50%, resulting in an additional $89.5 million costs for Texas each year. Republicans also tightened the work requirements for SNAP, requiring those between 52 and 65, as well as those with children over 14, to prove they are employed for at least 80 hours monthly to remain eligible for benefits. Immigration and border funding. Texas's priority, ensuring reimbursement for the billions spent on border security during the Biden administration. The final draft of the bill allocates funds to reimburse Texas after Governor Greg Abbott's extensive lobbying. Initially, the Texas GOP aimed for $12 billion, but ended up securing a total of $13.5 billion in the Senate version, ensuring Texas has the largest claim. Additionally, the bill provides U.S. Immigration and Customs Enforcement, ICE, with nearly $30 billion to enhance its operations and increase deportations, a central campaign promise of Trump. Clean energy and taxation, a push and pull in Texas's future. The rollback of former President Joe Biden's Inflation Reduction Act includes limitations for clean energy development, Under the new agreement, tax incentives are now restricted to already operational wind and solar projects. By the end of 2027, projects commencing within a year of the new law and becoming operational post-2027 remain eligible. Some Republicans wanted an immediate cessation of these credits, citing reliability concerns for renewable sources and favoring domestic distribution. Clean energy proponents argue that reductions could stymie the labor market and hinder Texas's growing energy needs. The argument on tax cuts and economic balance. Finally, at the center of the Republican Megabill is the extension of Trump-era tax cuts, slated to expire at the end of this year. The reform ensures that most Americans continue to benefit, particularly helping households in Texas with an average income of $75,780 from seeing their tax burden increase. A thought-provoking question. Do you believe that these tax cuts mainly help the wealthy at the expense of lower-income families? Share your thoughts in the comments below. Education and youth financial growth, the Pell Grants and Trump accounts. Megabill also reached an essential area of Texas' future, education. Pell Grants, crucial financial assistance for low-income students, narrowly avoided cuts. Additionally, the proposed expansion includes grants for short-term workforce training programs, aiding transition into the workforce. Lastly, the Trump Accounts Initiative will see $1,000 seed money in a tax-deferred investment for every child born in 2025 onward. Over time, this can accumulate, supporting various financial milestone goals. What do you think about this long-term vision for youth financial growth? Let us know your perspectives. TribFest 2025, presented by JP Morgan Chase.